You, sir. It was wonderful to be here.
Up next, we have Dr. Stephen Nelson, who is the founder and clinic director of Synergy Wellness Center. Dr. Nelson will be discussing nutritional intervention as an alternative and as a complement to drug therapies. If you have failed aggressive drug therapies, or if the medications you're taking are just not working anymore, you don't want to miss this next segment. We'll be right back. You are watching The Wellness Hour. I'm Randy Alvarez. My guest today is Dr. Stephen Nelson, who is a doctor of pharmacy and a PhD in clinical nutrition. The results Dr. Nelson has been getting with his patients is remarkable. Dr. Nelson is the clinical director of Synergy Wellness Clinic. He specializes in nutritional interventions for chronic diseases and subacute illness. Dr. Nelson, welcome to the show.
Thanks for having me, Randy.
Dr. Nelson, tell me about your practice.
Well, we've been in practice for about 15 years. We've seen every syndrome, every problem come in the door that you could probably imagine. We generally get failures of allopathic therapies that just are not working.
What do you mean allopathic?
Standard Western medicine things.
Okay.
For example, the drug surgery issue. Okay? That's generally what happens.
What do you mean by drug surgery issue?
Well, in the standard practices, hospitals generally use two things. Doctors' offices generally use two things. If the medications don't work, then surgery becomes the option. And it's generally back and forth between those two.
Now, you have 2 doctorate degrees, is that correct?
That is correct, yes.
Now, you're a pharmacist.
Yes, I am.
Is that right? And then you are also a what?
I have a combined PhD in clinical nutrition and clinical biochemistry.
So how did you get involved then in opening up an office that goes to the root cause of diseases? How did you make the transition?
When I had my pharmacies, I had people continually come in and get the same drug over and over again every month and weren't getting better.
Is that right?
That is absolutely true. But the real kicker was when my wife got seriously ill and no one could help her.
Really?
She had been to Stanford, she had been to major institutions. I had consulted with those institutions. She had major heart disease. Now she's doing very well thanks to natural interventions and natural therapies.
So with your wife and with your patients, are you approaching it from an immune boosting standpoint? Is that what you're doing?
I think that's correct, but I think it's partially correct. I also think more of it has to be, when we look at a patient, we look at it from the standpoint of aggravators that make the immune system weak or make it go into overdrive. For example, people that can't sleep, their immune system's in overdrive. People that have adrenal function that's reversed, their immune system is in overdrive. Generally speaking, what happens? Their clock is reversed. So they are more awake at night than they are in the daytime.
So with the sleep example, explain to me what you mean by that. Their system is in overdrive.
Basically, the adrenal glands go into overdrive at night, or the pituitary gland goes into overdrive at night. You sleep for a reason. You sleep to repair tissue. If these glands are not functioning in normal range, then we need to figure out why you're having the sleep disturbance, or the adrenal or the pituitary is not working properly.
Is that something that's easy for you to turn around?
Absolutely. We look at adrenal stress indexes, which is salivary. We can do that. We use the nutritionals, which are all pharmaceutical grade nutritionals and homeopathics, to augment the human body and put it back in its rhythm. So that's part of the immune issue. The other immune issue is one that's going to continue to plague us for long after I'm dead, and that's toxicities.
Really?
Petrochemicals, metals, especially fillings, pesticides, herbicides, water, food, air. We are seeing more and more.
We are all exposed to this. What are we supposed to do?
Well, you can't run and hide. What you do is you come to a practitioner like me that knows how to give you the right basic 2 or 3 nutritionals so you continually detoxify yourself.
So you can fight this off?
Absolutely. And we're doing it every day in our office.
One of the reasons why I invited you on the show is because you work with people that have failed conventional, traditional drug therapies. That means they got a disease, now they're treating it with drugs. How is your approach different?
Our approach is different because we not only look at why they're on the drug, we're going to do the body fluid analysis, as what Dr. Eidner had mentioned, but more importantly, we got to look at why the drug is not working, what the target organs are, and what the root causes of why they're on the drug to begin with. And there's one more thing. People forget that when you take a drug, it just doesn't disappear. It has to be metabolized by essential pieces of